All right, welcome to our high-speed review session. We're going to get you ready to absolutely ace your exam on common diseases and disorders. No fluff, just the stuff you really need to know.
Okay, so your exam is right around the corner. I get it. We are going to blow through the most critical, the most testable info from this chapter in just the next few minutes. So you ready? Let's do this.
So, we're starting with the real foundations of patient care, communicable diseases and cancer. You got to think of these as the core principles because you're going to see them pop up in all sorts of situations.
First up, communicable diseases. I mean, the definition is pretty straightforward, right? It's any illness from an infectious agent that can jump from person to person. We're talking about things you've definitely heard of, like the flu or C. diff.
Now listen up, because this is super important for your exam. If you see a question, any question about communicable diseases, your number one answer, the golden rule, is always to follow standard practices and transmission-based precautions. And that means, you guessed it, meticulous hand hygiene. It is absolutely non-negotiable. Seriously, burn that into your brain.
Okay, let's switch gears to cancer. You know the common types: lung, breast, and so on. And you know the treatments: surgery, chemo, radiation. But here's the key takeaway for your test. Your focus as a caregiver is almost always going to be on managing the side effects of those treatments. So you're thinking about comfort, mouth care for those painful sores, helping with nausea, and of course, providing that absolutely vital emotional support. All right, now that we have those foundations down, let's move on. We're going to talk about the systems that control movement and communication in the body. And we'll start with the biggest organ of them all, the skin. So look how these two systems connect to their priority care. For the integumentary system, that's just a fancy word for skin, you've got to be thinking about pressure injuries. So what's the key action? Frequent repositioning, at least every 2 hours. Then you have the musculoskeletal system, bones and muscles, where you're worried about things like arthritis and fractures. The big thing there? Promoting safety to prevent falls. See the pattern? It's all about watching closely and keeping people safe. Okay, let's zoom in on cast care, because I can almost guarantee you'll see this on your exam. Yeah, you elevate the limb on pillows, you keep the cast dry, that's all important. But steps 3 and 4, that's where it gets critical. You have to be watching for complications. We're talking pain, numbness, swelling, pale skin, and if you see any of those signs, you report them immediately. No hesitation, it's a huge deal. All right, the neurological system. This covers everything from Parkinson's to strokes. Now, if you only remember one single word for this entire system for your exam, make it this one: safety. I mean it. Whether you're preventing falls, helping with ADLs, that's activities of daily living, or stopping complications like pressure injuries, safety is the absolute, hands-down, #1 priority. Always. Okay, time for a quick pop quiz to make sure this is sticking. You've got a client with a new cast, and they're complaining of numbness. Their skin looks pale. What do? What's your priority action? Come on, you know this one. You report it immediately. Yes, you got it. That's a potential emergency, and you just spotted it. Next up, we're heading into the body's engine room. We're talking about the systems that regulate and transport everything. And we're kicking it off with the endocrine system, and you guessed it, its most famous disorder, diabetes.
When it comes to diabetes, you absolutely have to know the difference between low blood sugar, which is hypoglycemia, and high blood sugar, hyperglycemia. Just look at the signs here. They're pretty distinct. Confusion and shakiness for low blood sugar versus being super thirsty and peeing a lot for high blood sugar. The care for both, you see those signs, you report them right away. Oh, and don't forget this. It's another huge, super testable point. Meticulous foot care is absolutely essential for anyone with diabetes.
Okay, let's tackle the heart and lungs together. For cardiovascular issues like hypertension and CHF, that's congestive heart failure, and for respiratory problems like COPD, the real key is recognizing those urgent symptoms. For the heart, you're looking for chest pain or swelling in the legs. For the lungs, it's a cough that's getting worse or more shortness of breath. Any of these are red flags that need to be reported ASAP. And here's a fantastic little keyword to lock away for your exam. If your client is struggling to breathe, your first thought should be one word: upright. Putting them in an upright or Fowler's position just uses gravity to help their lungs expand. It makes a huge difference. So remember that word, upright.
All right, we're on the home stretch now, heading into our final set of systems. For this section, we're going to do a real rapid-fire review. I just want you to focus on the single most important thing you need to remember for each one. Ready?
Okay, let's do it. Immune system, like with HIV/AIDS, your priority is meticulous infection prevention, period. Digestive system, With GERD, remember our keyword? Keep them upright for an hour or two after meals. Urinary system? To prevent UTIs, it's all about encouraging fluids and providing really good perineal care. And finally, the reproductive system. The key here is to always provide care with sensitivity and respect for a person's dignity.
Whew, we have covered a ton of ground. So now it's time for the final summary. This is the "if you remember nothing else from this whole thing, remember this" part. Pay close attention. Core principle number 1, safety first. You heard this theme over and over, right? It's about preventing falls, especially for folks with musculoskeletal and neurological problems. It means repositioning clients to stop those nasty pressure injuries from forming. It's all about making sure safety is always your top priority.
And core principle number 2, infection control is absolutely key. We started with this when we talked about communicable diseases, and it kept coming up. Meticulous hand hygiene, following standard practices. These aren't just suggestions. They are essential for protecting every single person you care for, especially those whose immune systems are already weak.
And that brings us to our final core principle. Always observe and report. You know, your eyes are one of the most critical tools you have. Whether you spot a new rash, notice numbness in a limb with a cast, see the signs of a blood sugar issue, or hear someone complain about chest pain, your job is to see it and report it immediately. That is how you protect people from real harm.
So, let's wrap this up with one last question to bring it all home. What is the single most important care measure we talked about for all communicable diseases? You got it, meticulous hand hygiene and following standard practices. Nail that and you are well on your way. Hey, you've got this. Go crush that exam.